So welcome to Wellness Warriors, another edition. And today I'm really excited to have Dr. Trevor Cates. She's an amazing, amazing naturopathic doctor. And let me show you her book, Clean Skin from Within. I love it. It's been an amazing book. I devoured it, and it's just a beautiful, beautiful book. But she's also known as the spa doctor. And as you stay tuned, you'll know why she's called the spa doctor. But I didn't know this about you, that you were the first woman licensed as a naturopathic doctor in the state of California, appointed by former Governor Arnold Schwarzenegger to California's Bureau of Naturopathic Medicine Advisory Council. That's a mouthful. So congratulations, girl power. That's awesome. That's awesome. So you live in Park City, Utah, but you consult with people all over the world, and your passion is to be able to help women achieve graceful aging, which we're all excited about doing as well. And she's very popular. I mean, she's been on The Doctors, on Extra, First for Women, Mind Body Green. She even has her own PBS. Her own PBS special. It's called Younger Skin from Within. And she also has a podcast, which I've been a guest on as well. So I'm really, really excited to be able to have you on our show and to talk about healthy and graceful aging. And I love how you say that, our skin is an indication of what's going on the inside of our body, and it's an expression of our health. So how did you become known as the spa doctor?
So I was working in certain spas, of Waldorf Astoria and a St. Regis in Park City, and I was just the doctor in the spa. So I got to become known as the spa doctor, and it's a name that kind of stuck, and also as what I decided to name my skincare line after my company. I'm no longer working in those spas anymore, but one of the things that I really want, when it changed a lot of my focus when I was working in the spas, is people started asking me a lot about skin issues. And I've always thought about healthy skin from the inside out and the importance of that. And that really started from when I was a child struggling with my own health and skin issues. I had a lot of allergies and hives, eczema, little bumps that appeared on my face mysteriously. And my parents kept taking me to different doctors, and I unfortunately had a lot of different reactions to medications, and started just feeling worse and worse, and missed a lot of school. I was sick a lot. And my parents kept searching though, and the one thing that turned my health around was when they found a holistic practitioner that they took me to. And so once I started looking at this more from a young age, looking at more of a holistic approach to health, I realized from that early age, that there's this whole other world of medicine that a lot of people don't even know about. And I became very curious about it, and it kind of set me on that path to eventually become a naturopathic physician. And so I've always learned and understood, and then had the experience of really realizing that our bodies give us great messages about our health. And one of the best ways, the easy way for us to check in with our bodies, is to look at our skin. So I call skin our magic mirror that gives us great clues about our overall health. And it is our largest organ of our body, and it's right on the surface. We don't need special imaging equipment to see it. We don't need x-rays, CT scans, any of that. We can just look in the mirror and see, or look down at our skin, and we can see what's going on. And so when our skin is dry, or we're breaking out more, or we're having hives or eczema or itchy skin, or any of those kinds of things, a lot of time there's some sort of internal imbalance that's going on that we need to address. And the typical approach to dermatology, to skin issues, is to use something to just suppress the symptom, just to cover it up. Or women will, a lot of times, will just wear more makeup to cover up rosacea or acne or hyperpigmentation issues, instead of really looking at what's behind that. What is your body actually trying to tell you?
That's awesome. I love that expression, the magic mirror, because it's so true. Look in the mirror, and then your skin is an expression of what's going on inside your body. Now, in your book, you talk about clean skin from within, and you talk about 5 different skin types. Can you elaborate on that?
Yeah, so the typical skin type approach is dry, oily, mature, sensitive, those types of skin descriptions, but it doesn't really give us information about what's going on behind those skin issues. So what I decided to do was redefine skin types to help people, because when I work with people one-on-one, it's like solving a mystery, sort of trying to figure out what those root causes are. And so when I wrote my book, I wanted to think of a way to help people identify those root causes that are particularly an issue for them. Now, I find that there are 6 root causes behind skin issues. And so what I did with the 5 skin types is I grouped them based upon the root causes behind them. So that helps when people identify their skin type, then they can address the root causes better. And I also decided to give the skin types human names, because I see all of my patients as people, not just a skin issue. So they're Olivia, Sage, Emmett, Heath, Amber. Those are the skin types. And so people can go to theskinquiz.com. It's a free online quiz they can take and find out their skin type. But I also delve into it in the book too.
Okay. Yeah, I thought that was very brilliant, the way you described the different skin types. It's not your typical explanation like a typical dermatologist would use. All right. So
Right.
another topic that you talk about is a 2-week plan to clean skin. Now we know, as you mentioned, the skin is the largest organ of the body. It's also the largest organ of detoxification. So if our health comes from within, what are the first things that a woman, since our audience is mostly female, what should they look for and what should they do in those first couple of weeks that really stands out from their traditional way of doing things?
In the 2 weeks.
Right, in the 2-week
Yeah.
plan, yeah.
Yeah, so I have the 2-week plan is broken down into 4 different parts, and it's clean plate, clean slate, clean body, and clean mind. And so the clean plate are the foods to eat and the foods to avoid. So that when of course we want to choose clean foods, we want to avoid the big trigger foods and instead eat foods that are actually nourishing our skin from the inside out. We want to have a clean slate. That is what we put on our skin. We want that to be clean. And then instead of harmful ingredients like endocrine disrupting chemicals or hormone disrupting chemicals that definitely play into issues like breast cancer and a lot of different hormone imbalance issues, instead of using chemicals that are known to, or products known to contain some of those chemicals, we want to use things instead that actually nourish our skin and help the skin microbiome. And then the third part is the clean body part, is also reducing endocrine disrupting chemicals and other chemicals in your other parts of your environment, in your home, in your water, in your air, and all those sorts of things. And then what can you do to support your body's ability to detoxify with liver, kidneys, lymphatic system, skin. And then the last part is clean mind, because stress is like a toxin to the body, and so we want to make sure that we're not forgetting about that part, because it definitely plays into hormonal imbalances, which is one of the big root causes behind skin issues. Also, inflammatory skin inflammation is another big root cause, and stress, if we're not managing it well, can increase our cortisol levels and then also create more inflammatory skin issues. So those are the 4 different aspects of it. And then I just kind of, in the 2 weeks, I guide people through how to do it. And it's not that 2 weeks is some sort of magical time that you do and then you go back to eating junk food, but it's sort of what I consider a reset. So usually within 2 weeks, it's enough time for people to start noticing a difference. And then they can tell what things they want to continue. So what they can identify their big trigger foods, the things that they definitely don't want to continue to do that they realize may have been harmful before, and maybe new habits they picked up along the way that they want to continue. And so it's really about about nourishing the skin from the inside out, providing that foundation. And it's the reason why I started with 2 weeks is that's what I was doing in the spas. I was actually doing a 2-week weight loss program. And one of the big things, in addition to the weight that people get more down to their ideal weight within that 2-week period, is people would talk about their skin and how they were surprised to see their skin issues clear up, or their just skin being more vibrant looking. I mean, you've got beautiful, glowing, vibrant skin too, and you live a healthy lifestyle. I mean, it's a side benefit of
Right.
living more of a healthy lifestyle. And so the 2 weeks it really came from that. And then I've just expanded upon that.
Okay, very good. So you talk a lot about trigger foods. What are examples of trigger foods that people should avoid, and foods that they should start incorporating in their diet?
Yeah, it probably won't surprise you that sugar is one of the big trigger foods.
Mhm.
It is more of a pro-inflammatory food, so that is part of the reason why it's one of those foods that tends to be a trigger food. But also, it actually accelerates the aging process because of what the problems it causes with glycation. So with sugar, when you eat a lot of sugar or foods that turn to sugar, it increases your blood sugar, which can cause glycation issues. That means that glucose will bind to proteins in the body. And then so when we're talking about skin, we're talking about the collagen in the skin that gives our skin that nice texture and structure that keeps us youthful looking. And it does tend to decline as we age. And so it will bind to that and makes it more rigid and less elastic, and really speeds up the aging process, or the appearance of aging in the skin. So that's one of the reasons why sugar is an issue. And then also for people who tend to get acne, sugar is also one of those big triggers too. So what happens with that is that when we eat a lot of sugar or foods that turn to sugar, our blood sugar increases, and then that triggers an insulin spike. And with that increase in insulin, that triggers excess sebum production, the oils in our skin, as well as excess androgen activity. So androgens are the hormones that we know that the rise in those also is another big trigger for acne breakouts. So if you've ever eaten a bunch of sugar or kind of overindulged and then started to break out in acne and wonder why, that's probably part of the reason of that. So sugar is definitely I would say it's the number one food that I see related to a number of different skin issues. And so that would be the first one, but there are others like dairy products, which again, probably doesn't surprise you.
Mhm.
Also, things like gluten is another one that can be, especially for people that have things like eczema or psoriasis, that have this kind of the chronic itchy skin, or those kinds of things. Gluten can be a big trigger for people that have those skin issues.
Interesting. So I have a personal question about collagen. We see so much being advertised now in the natural food world. Have more collagen every day. It's going to help your skin. Is that a fact, or is that fiction? Taking in more
There
collagen.
Yeah, there actually is some research that does show that that consuming collagen peptides can help with the texture of the skin. There's also, there's been, as far as the aging of the skin and cellulite and different things, changes in the skin, it does appear that collagen peptides can help with that. So I do think that, it's always nice to have more research to support it. And I mean, to what extent it really helps us, it partly depends on genetics and the person and the other things that you're doing, because we can't just take collagen supplements and then eat a bunch of sugar, which is going to break down collagen, and then go out in the sun a bunch and get sunburn, which is also going to cause collagen breakdown. We want to be mindful of a lot of other things. It's not just this magic thing that we could take collagen and then just
Going to be a
live an
cure.
unhealthy lifestyle.
Right.
I have a collagen supplement. I think that there are other nutrients that help support collagen that are good to include. Things like vitamin C also it helps us support our own collagen. And it also seems to help with nice. It's a nice combination to do with doing collagen peptides.
Okay, excellent. Now, earlier you talked about the skin microbiome. You know, we hear so much about our gut microbiome and how important that is for our immune system. Tell us a little bit about the skin and the microbiome on the skin. That's very fascinating to me.
Yeah, it is really interesting, and it's exciting because there's more research coming out about the connection between the gut and the skin, and also the gut brain skin connection, and a lot of that has to do with the microbiome, and so yeah, as you mentioned, there's a lot of talk right now about the gut microbiome and how dysbiosis, those imbalances in our microorganisms, can really create a lot of different issues in the body. And there's definitely a direct connection between the gut microbiome and the skin microbiome. So the skin microbiome, though, is a very different group of microorganisms that live on the skin. They're very different than in the gut, but it's also very important. And so that's one of the reasons why we want to have a good gut microbiome if we're trying to improve our skin, is we definitely want to address that, because I think this is one of the big root causes behind a lot of skin problems, is that connection. So from the inside out, we definitely want to address that. Now, also what we put on our skin can impact the skin microbiome. These antibacterial, antimicrobial soaps that are really popular, those actually, or cleaning products, those can actually damage our skin microbiome. Also, the pH of our skin is really important. Our skin has this mild acidity that gives us this natural barrier of protection and helps promote a healthy skin microbiome. And a lot of the soaps and cleansers out there have a high pH, so it actually disrupts that natural barrier of the skin and can then lead to more problems with the skin microbiome. So using skincare products that have a mild acidity actually helps promote an environment that helps your skin microbiome flourish. So it's one of the reasons why I created my skincare line, is because it's one of the things that I noticed was missing in a lot of the natural skincare products, or just skincare products in general, is things that really help promote that mild acidity, and that also promote the skin microbiome to help it flourish.
That's awesome. And if we look at ingredients, even in like Whole Foods, and they're labeled organic, there's often some very questionable ingredients in skincare products. And can you talk a little bit about that?
Yeah, it is kind of crazy how many different products are out there with harmful ingredients. And I think a lot of people aren't aware that what they put on their skin can actually get absorbed into their bodies. And it's not like when we eat a product, when we eat, a substance, it definitely has a different absorption than when we put it on our skin. There is a barrier there. It's absorbed differently, and molecule size and those sorts of things are going to make an impact on how much it's absorbed. But from the research, we know things like parabens show up in human tissues. Now, parabens, you'll see them on labels on personal care products like methylparaben, butylparaben, propylparaben. They're used as preservatives in personal care products. Even some so-called natural skincare products, I know still sometimes will contain parabens. A lot of companies are starting to remove parabens from and replace them with other things. So that is a good thing. But the studies have actually shown parabens showing up in human samples, in urine samples, and even in breast tumor tissue.
Breast tumors, yes, I was going to say that.
Yeah.
High levels of parabens, yeah.
So those studies don't mean that parabens cause breast cancer. It's hard to make that direct correlation based upon those studies. But what it does show, because we still don't know, we need more information on that. But what it does show is that when we use these parabens on our skin and our personal care products, it can get absorbed and it can get taken up and stored into tissues like breast tumor tissue. So it's one of those things that we definitely want to avoid. And we know that parabens have these estrogen mimicking effects.
Yeah.
And so another reason to certainly, especially for your audience, to avoid parabens. But parabens are not the only thing. There are, on average, according to the Environmental Working Group, EWG.org, they, on average, people use 9 personal care products a day, which exposes us to 126 unique ingredients. It's a lot of ingredients that can be in our personal care products. And in Europe, they've banned over 1,000 ingredients in personal care products. But in the United States, it's like 11 ingredients that have been banned. And so it's really up to us. I know it's really up to us to be aware of what we're putting on our bodies. And so just like you're reading your food labels and probably your supplement labels, you also want to take a look at your skincare labels too. So I mentioned parabens as one. So I want to mention another, at least one more for your audience to look for. Another big one to avoid is fragrance. If you see fragrance on the label, that actually isn't just an ingredient. It's a group of ingredients, but the manufacturer doesn't have to put that on the label because it's, that's just what they are allowed to put on. But it's an opportunity to hide a lot of ingredients that don't actually have to be listed. One of the things that's usually in fragrance is diethyl phthalate. Diethyl phthalate is a type of phthalate. They're usually known as plasticizing agents, and it's used to make the fragrance, the smell last longer. But it is a known endocrine disrupting chemical, that hormone disrupting chemical. And we definitely, if we're trying to be aware of breast cancer prevention, or if someone has breast cancer and they're going through treatment, definitely want to be avoiding these hormone disrupting chemicals, endocrine disrupting chemicals, want to stay away from those. And so that's just another example, but there could be other things hidden in fragrance. So instead of using synthetic fragrance, you can use things like really nice essential oils. And I love essential oils as an alternative because not only do they not have that downside of being endocrine disrupting chemicals, but they also have health benefits and mood enhancing benefits. So when we use things with essential oils, that smell can help alleviate, help us, give us a nice little mood boost. And I think that skincare and personal care products is a great opportunity for part of your self-care routine. And it's that self-pampering, that self-love that we all need to do. And I think women, we are so used to being caregivers, taking care of our children, our parents, our spouses, our partners, and everybody around us. And then those of us that are practitioners too, we're taking care of our patients, and we oftentimes forget to take care of ourselves. So I think it's really important to find that time for self-care, and finding a really nice, clean, natural skincare routine is part of that self-care process.
Good. I'm glad you mentioned that self-care, because so many women that we've worked with, they feel guilty about doing nice things for themselves or taking the time to take care of themselves. And it's so important to carve out that time. Now, another big question I have is the sun.
Yeah.
Sorry.
I was just going to say, it's just, it's hard to take care of all these other people as well if you're not taking care of yourself. I think it's obvious, but I just want to explain, it's not just, you need to take care of yourself, but you actually have to if you want to keep taking care of all these other people.
That's right. That's right.
Let's transition to sun. Yeah, that's a hot topic.
Okay. So I like being out in the sun. Unfortunately, in my early years, I was in Canada. So when the sun came out in the spring and summertime, baby oil on the skin, lay out there for, hours at a time. I've grown older and wiser since, but, I spend a lot of time in Florida. And so what do women do when it comes to skincare and the sun, especially if they're very outdoor people?
Yes, I think it's an important thing to talk about. People ask me about this a lot because I do think, I mean, I live in Park City, Utah. I love to get outdoors, mountain biking, skiing, running, whatever I can do to get outdoors. I think it's great, and there's so much therapeutic value in sunshine and being in nature. We get vitamin D from the exposure to sun, and so there is a lot of importance around that. But we do want to be careful about the sun damage. And so what I tell people is to get that vitamin D exposure, you really just need to expose your arms and legs to the sun 5 to 10 minutes a few days a week. That's for really in the non-peak sun hours. That's for most of us, we get enough sun for vitamin D. And then also have your vitamin D levels checked when next time you're with your doctor. You can ask for a 25 hydroxy vitamin D. And so if your levels are lower, they're on the low end of the normal range, then you can actually take a vitamin D supplement to help with that. And then you know, you can make sure you're getting the vitamin D that you need. So that's, you know, a lot of times people ask me about the vitamin D. So, but when it comes to protecting your skin, certainly wearing hats and staying in the shade when you can, and that sort of thing is always great. But we're still going to want to use something on our skin. A lot of the products out there are chemical sunscreens, and the problem with those are things like oxybenzone, and there are a number of others, these chemical sunscreens. Many of them have been linked to having hormone disrupting effects, as these endocrine disrupting effects. And then also there's starting to be some bans on some of these, like in Hawaii, because of the environmental impact that they can create. So many people spraying and putting on these chemical sunscreens. Not only is it impacting your health, but it is having an impact on the environment too. So we're trying to shift away from using those. Zinc oxide mineral sunblocks really are a better option. And so zinc oxide is the active ingredient that you want to look for. And I know that a lot of people are concerned because it's pasty and it's white, but there are certain brands that do a better job of making it so that it goes on well, and it provides some nice protection. And for women, one of the tips that I like to recommend is to get a tinted version for your face. So it almost like works like a foundation because it's kind of thick. And then if you add the right, you know, you get the, you know, light, medium, or dark, depending upon your skin tone. It almost works like, you know, that would be your makeup. And then you've got that protection on your face for the day, and you don't have to worry about it being so white. So that's a couple of tips. One other thing I would say is be careful with the sprays. A lot of people, they're very convenient, especially with kids, and they're active and running around and you're trying to spray them, that you think about the fact that you're going to be breathing these things in. So certainly the chemical sunscreens, we don't want those anyway. And certainly now you're breathing them in too, and your children are breathing them in. But even with the nano-sized or micronized size mineral sunblocks, the concern is when we get those in powders or sprays, that we can actually breathe those in and they can get into our lung tissue and create some damage. So I recommend that if you're using any sprays, just make sure they're not the nano-size particles. They're just those teeny little size particles. Mm-hmm. And it usually says it on the label, or you can look for one that says non-micronized or non-nano-sized.
Okay. Now, do you have a sunscreen in your skincare line?
I have one. We sell one on the website, and it's Davita, and they come in different shades too. So I sell it at thespadoctor.com. We're working on one. Eventually we'll have our own, but for now I just wanted to sell one that I recommend from somebody else that I found.
Good,
and then also we do want to be just as far as a few more tips, like just you need to keep reapplying. Don't just think that you're going to put it on and that it's going to provide protection all day. When you get on the water, when you perspire, when you exercise, you need to keep reapplying. Most people don't use enough of the sunblock, and you want to use at least an SPF of 15. You know, SPF of 30 is probably better for most people, and really anything much higher than that, it's questionable whether it really provides that level of protection or gives people this false sense of security.
Okay, great. No, that's great because that's a question that comes up often
Mhm.
as far
Yeah.
as, sun protection. So you have a few recipes in your book that people can easily whip up for their skin. So can you tell us, give us a few examples?
Yeah. So in my book, Clean Skin from Within, I do have food recipes for people to eat as well as recipes for DIY skincare because it's nice. It's kind of fun to do masks and different treatments and toners and things to be able to make up in your own kitchen. And really, if you think about it, it's one of the ways that we can ensure that we're getting clean products on our face. So if you have, you might even have certain things already in your kitchen, things like honey and oats and yogurt, and those are all great. And with oats, what I recommend is people grind that up into a flour. You don't want to use anything rough on your face that's going to be scratching and really abrasive, but you can mix up that combination of ground up oats and or you can even cook them a little bit and use them that way, and honey and yogurt, and kind of make up a nice little face mask. Another tip, an easy one, is if you get a pimple and get one that just kind of pops up out of the blue and trying to figure out a quick thing to do to get rid of it, just make a little paste with honey and turmeric. You just make a tiny little amount and then you just dab it on that spot, leave it on for maybe 5-10 minutes, rinse it off, and it has really nice anti-inflammatory effects, and I find it works great. Now, if you have more moderate to severe acne, you're going to need a little bit more than that provides, but the occasional breakout, that's
Yeah,
good.
that's fun. Yeah, I've tried some of the things that you have in the book, and they were very refreshing and felt very good. So it was fun. So you have a skin quiz, so women can find out what their skin type is and how to best approach it. And where would they find that?
They just go to theskinquiz.com. So yeah, it's a free online quiz. It just takes a few minutes to finish it up, and you'll get some great information and recommendations based upon your skin type, which has to do with the root causes behind them.
Excellent, excellent. Well, thanks so much for your time, Dr. Trevor. You can find out more information about her skincare line, which I've tried, by the way, and it's awesome. I really, really enjoyed it, at thespadoctor.com, and fill out the information on theskinquiz.com as well, and she'll send you some amazing information on how to promote youthful, beautiful skin. As you can see, Dr. Trevor herself is a living example of that. So thanks for sharing your information with my audience, and appreciate you very much.
Thank you. It was great being here with you.
Okay, talk to you soon. Bye-bye.